Back in January 2019, 11% of people were saying they felt some level of anxiety and depression. Fast forward to January this year, that has jumped to 41% of people. It's like feeling bad is the new normal.
It's been a traumatic year. People have suffered tremendous loss this year, loss of feeling safe, maybe actual loss of their physical health or a family member, loved ones. There's been economic strain and loss, job loss. People have been increasingly aware of systemic racism and what that's engendered. So many things have gone on this year with great uncertainty about when, if ever, they're coming to an end, that it has precipitated this sharp rise, as you're saying, what we're calling really a pandemic of mental health issues, of depression, anxiety disorders, substance use and abuse is way up, domestic violence is up. All of the issues that give people like me great concern.
How do we know the difference between finding ways that we can cope on our own versus when is it time to actually book in an appointment with a professional?
I'm a big proponent of self-care, no doubt. Aerobic exercise multiple times a week, deep breathing to relax yourself, talking with friends or family for support. But once you're feeling these feelings every day for a couple of weeks, such that they are interrupting your ability to enjoy anything you used to, work productively and be with family in a productive way, if you're irritable and you're having angry outbursts, if you can't concentrate and therefore can't read, can't watch something, can't work productively, these are signs and symptoms that something more is going on that really isn't probably going to be handled by self-care. There are lots of different kinds of treatments out there, psychotherapies, medications, that are very effective.
I mean, I've had all sorts of therapy for all sorts of issues. I was in an abusive relationship and got divorced, and that was a very serious thing that I needed to work on for a long time. And sometimes you can feel so deeply in a funk, but all it takes is a couple of sessions.
Lots of people have misconceptions about mental health care. They think, oh, if I go in, I'm going to be there forever, and I don't want that. That's not true. Most psychotherapies are really time limited. They think, oh, if I take medication, it's going to change my personality. That's not true. There are a lot of myths about mental health care that keep it stigmatized, to be honest. It's part of the reason I'm partnering with Next Gen Healthcare this month to really talk about stigma and how, we need to move beyond that. I mean, more people, close to half of all Americans at some point will struggle with a mental health issue. It's just such a common medical problem. And so we need to move beyond the stigma, and people need to understand that they can get a time-limited, a timely, and affordable mental health care treatment that can make a huge difference in their lives.
So there really are a lot of resources available through NextGen then when it comes to taking care of our mental health.
Absolutely, mental and physical health, but this campaign this month of Next Gen Mind is really helpful for mental health care, because for a lot of people, and particularly this is important, if you know someone, if you're close to somebody who is struggling, it's best to go say something to them like, hey, I really noticed this and I really want to help you, and I can help you even find someone or help you set up an appointment, because sometimes when you're really depressed or really overly anxious and distraught, it can be hard to organize yourself enough, right, to find the care.
I'm so glad we got to talk today. Thank you so much, Dr. Gail Stoltz. This has been great, and we can all start taking care of ourselves and getting through this.
Thanks so much.
Some great information for you at nextgen.com. Go check that out. And you can help yourself, you can help your friends. We've been through some tough times.